This video is on infective endocarditis, an infection of the endocardium, which is technically the most inner layer of the heart, but almost all of the time this is caused by infection of the heart valves. So let's look at some common causative organisms. Staphylococcus aureus is a high virulence bacteria which can affect healthy valves, and because it's located on the skin, it's also a common causative organism in IV drug users. Strep viridans is also very common, but most common if the patient has had recent dental work or the heart valve has been previously damaged from causes we will explore later in the video. Strep bovis is a gut bacteria and is associated with colon cancer. So if it's detected, you also want to screen the patient for colon cancer. Finally are the Haeckel organisms. So Haemophilus, Agrobacteria, Cardiobacterium, Isenella, and Kinella, which are all bacteria located in the mouth, in the oral cavity, and hence are associated with patients who have poor oral hygiene or have had recent dental work. The pathophysiology is basically due to injury of the endothelium, and this can occur in two ways. So the first way is a previously damaged valve, and this could be from a congenital defect, such as a bicuspid aortic valve, intraoperative contamination if they're replacing a heart valve, or rheumatic fever. And rheumatic fever is a cross-reaction from antibodies developed against a throat infection. So the patient may have got a strep throat infection, develop antibodies to fight off the strep infection, but unfortunately, these antibodies get confused and also attack the heart valve, leading to a reaction there. And this is known as a sterile vegetation because there's not yet an infection at the valve. But this vegetation acts as a site of attachment for bacteria. Secondly, the more virulent bacteria may injure the valve directly, leading to platelets and fibrin going to the area and actually warning the bacteria off from the rest of the host immunological response, meaning it can continue to proliferate. Let's look at the clinical presentation and complications, which will mainly be cardiac, vascular, and immunological. So cardiac, you would have a new murmur, most commonly a mitral regurgitation murmur, so a systolic murmur radiating to the axilla. However, if there's a bicuspid aortic valve, you may have aortic regurgitation, and tricuspid regurgitation is almost always caused by IV drug use. You may also have signs of congestive cardiac failure, and if the abscess from the valve spreads beyond to impact the electrical conduction system of the heart, you may get arrhythmias. Due to a systemic inflammatory response, you can get constitutional symptoms such as fevers and myalgia. Vascular effects include Janeway lesions, which are non-tender lesions shown in this picture. You may get the emboli shoot off into the lungs, especially right-sided, such as tricuspid regurg, causing pulmonary emboli or pulmonary infarcts. And then if it goes forward up to the eye, you can get conjunctival hemorrhage. Immunological includes ocular nodes, which are tender, shown here, and that's how it's differentiated from Janeway, which are non-tender. Roth spots shown in this picture, which are essentially retinal hemorrhages, and glomerulonephritis, a similar mechanism where you have a reaction of antibodies in the kidneys. Diagnosis mainly focuses on clinical presentation and complications, but the two diagnostic investigations are shown here. So the first one is an echocardiogram, where you can see the valve vegetation circled in blue and blood cultures. In this case, it's a gram-positive bacteria growing in chains, so you would think Streptococcus. If it was growing in clusters, you'd think Staph aureus. Treatment involves treating the infection, so appropriate antibiotics, and if it's severe, a valve replacement. Thank you for watching. If you learned something, please tell a friend who may also find it useful.